Former Secretary of State Colin Powell was considered a breakthrough case. He had his COVID vaccine, but he still died from the disease this week. Now, breakthrough cases and deaths are top of mind. Idaho health leaders addressed concerns about breakthrough cases in their media briefing today. Our Andrew Bartline listened in. Andrew, do we know who's more likely to get COVID even if they're vaccinated?
Yeah, it's the same as what we've been told throughout the pandemic, Morgan. Age and pre-existing conditions continue to be the leading factors to becoming a breakthrough case. For Colin Powell, he was 85 years old and he had a history of cancer. Idaho Department of Health and Welfare says these are the people that are at the highest risk.
Numbers from the Department of Health and Welfare say 157 vaccinated people in Idaho have died from COVID-19 since May.
Not a large percentage of our deaths.
And in the same time frame, 974 unvaccinated people have died from COVID. Per 100,000 infections, health and welfare numbers say unvaccinated people are 3.75 times more likely to die from COVID. That's due to vaccinated people being more unlikely to get infected in the first place.
Vaccine breakthrough cases are occurring among older populations with underlying conditions.
Health and Welfare says 40% of breakthrough infections had a pre-existing condition. State epidemiologist Christine Hahn says pre-existing conditions are a key factor in becoming a breakthrough case, but age is an even more significant one.
That said, it's all based on what data you have and what data you can collect. It could be that someone severely immune compromised is at just as high a risk as someone who's 85, let's say. But the strongest data is certainly age-based.
After infection, however, the risk between vaccinated and unvaccinated people evens out. Health and welfare numbers show 1.35% of breakthrough cases ended death, while 1.28% of unvaccinated infections lead to death. The department attributes this to the older and sicker demographic that is most likely to become a breakthrough case.
It's a different population that is getting vaccine breakthrough cases in general. And so that might be contributing to some of the more severe outcomes we're seeing every once in a while in this population.
The Department of Health and Welfare adds the average breakthrough case, their age, is 13 years older than somebody who's unvaccinated and gets COVID. Again, Health and Welfare says age is the #1 factor for somebody being at risk of a breakthrough case. Morgan?
Really important takeaway there. Andrew, thank you so much.